So I think we can start off now. Thank you everyone who has started joining the event. So my name is Shikha Thagele, and I have started this new fitness invitation for everybody who are conscious on their health and fitness through a recent venture called My 1 Hour. So My 1 Hour focuses on strength training, yoga, and nutrition because we feel that these are the three most important aspects that contributes to the health and fitness of everybody. Uh, as part of my 1 hour initiative, we invited doctors on board, and then we thought that we will continue with a joint event with both of them where they can share their expert guidance on a series of events which we are planning to do for next couple of months. So the events which we are targeting is focusing only on women's health and fitness, and this is our first session in which we will primarily target to talk about PCOS and PCOD together. So with that, I let me introduce to our panel. We have Dr. Nupur Gupta, an extremely and established gynecologist from many years. Currently, she is heading the gynecology and department at Fortis, Gurgaon. She has also served a good amount of tenure at AIMS. Then
Thank you, Shikha, for inviting me. And I think we can start.
Yeah, I also have Dr. Shweta Verma with me. She is a renowned and an expert dietitian and has been in healthcare industry from last 20 years. She treats everybody when it comes to diet with complete care, where we can focus on the complete balanced nutrition irrespective of the stage and the phases of that person is. So with regards, feel free to ask any question by putting it on the comment. We will definitely answer that particular question for you. So we can begin our first question with Dr. Nupur. So Dr. Nupur, what exactly are the causes of PCOS and PCOD?
So, yes, PCOS, PCOD is very commonly spoken about, and lot of awareness has increased over the years. But yes, it is also called the mother of all lifestyle disorders. So, this is increasing. Why? Because our lifestyle has changed maybe after COVID, and with so many other changes that have come to our lifestyle, the incidence is increasing. In India, almost 1 in 4 women are likely to develop either PCOS or PCOD. We will come to why these terms are commonly used and what does it actually mean. But yes, it is a polycystic appearance of both the ovaries, which is seen on ultrasound. That is why it is called polycystic. And there are actually, they are not cyst in the ovary, but they are lot of ova that have developed in the ovaries. But coming to the cause, exactly we don't know what is the cause, but the most commonly found reason is firstly, it is genetics, that is family history. Either your mother, your sister, anyone in the family has had PCOS or PCOD, you are likely to have the same. Second important thing is your lifestyle. So lifestyle has three components. What is your diet? What you eat? How much do you exercise? How is your sleep? How you handle your stress? And so many other things. So second is the lifestyle reason. Third is that these ovaries start to produce lot of male hormones, that is the androgens, and that is why, because of increase in male hormone, there are a varied kind of symptoms that we see from woman to woman, and they vary from individual to individual, and it is a broad spectrum. So because of increase in androgen, there is increase in LH levels, that is luteinizing hormone. And other than that, there are other factors like chronic inflammation. So if your body suffers from inflammation, whatever may be the reason, then PCOS is more likely to develop. And when we talk about the measures that we take to handle such a condition, inflammation plays a very important role. And last but not the least is insulin resistance. And this is the reason that why we are after PCOS women or PCOD women, because this is this insulin resistance will lead to so many changes in the long run in their lifestyle, in their long term sequelae due to PCOS.
Thank you, ma'am. I think that has been an enlightening answer for everybody. The second question is again to Dr. Nupur. What are the symptoms of PCOS and PCOD?
Let us first discuss, is there any difference between the two? So PCOD is polycystic ovarian disease and PCOS is polycystic ovarian syndrome. And there is lot of confusion amongst women that I have this, but you have PCOD and I have PCOS, but actually both are same. They are used interchangeably. Earlier it was called PCOD, means disease. But now we have changed the terminology and now it is called PCOS, that is syndrome, because this is a vast spectrum. There are women who have only polycystic appearing ovaries on ultrasound and no other feature. It is just an incidental finding on a routine ultrasound that we find that, oh, I have polycystic ovaries. Another spectrum is that some women come to us with tendency to weight gain. There are some who will come with excessive hair growth, or there are some who will have both of these, or there might be women who have acne, and so on and so forth. So, but this is usually a problem from menarche to menopause. That is when the periods start and till the time when the periods end. It plays an important role in woman's life, and there are different challenges that we face, that we see at different stages of a woman's life. So if we talk about symptoms, that how do you know that you have PCOS and how do you need to evaluate? This thing starts from adolescence. That is the time when the period is about to start and the menstrual cycle starts. At this time, usually we say that having irregular periods is normal and your hormonal axis will stabilize in another maybe 1 to 1.5 years. It doesn't matter. But at this time, if there is a tendency to weight gain, if you are if you are gaining weight which is not appropriate as per your daily routine, as per your lifestyle, your eating habits, and you develop obesity at a younger age, and that is the time we need to suspect, and this is the time that we as gynecologists want to target adolescent girls so that we can correct the imbalance that is happening at this age and how we can prevent the long term problems due to this. But first and foremost, it is for mothers that they don't need to panic if you see polycystic ovaries on ultrasound, because it has no meaning unless there are other problems that you are facing due to this. So having acne in adolescent age is also a normal thing. It is at the time of puberty that you develop acne, but the kind of acne which doesn't respond to treatment, acne, if you are changing your lifestyle, if you are changing your eating habits, but acne doesn't respond, then you need to visit us or you need to see a dermatologist. And so we work in conjunction with each other. Secondly, if you have irregular periods, you are missing periods. So what do we say irregular period means? When you have cycles either before 21 days or after 35 days. In between is normal and it can vary from individual to individual. So having irregular cycles is another feature, and there are many other things. So should I discuss one by one?
Yeah. Yes, ma'am.
Yeah. So third thing, so first is acne, irregular cycles. Not only irregular cycles, there are women or girls who might miss their periods. So, for all those who have PCOS, who are missing your periods, but if you miss cycles and in a year you don't get at least 8 periods in a year, then you need to see a doctor because this is not good for your health. So, also we will see girls who are gaining weight. So there is obesity also associated. Almost 75 to 80% of PCOS girls will be obese or overweight, and the BMI will be higher. But at the same time, we also see girls and women who are lean, but they still have PCOS. They still have features of PCOS. So we need to find out what is the cause in that person. Is it insulin resistance? Is it genetic? Is it environmental? Is it your lifestyle which is leading to this? And accordingly, we will manage what problem you are facing. So these are all features of increase in androgen levels. That is the male hormone which is being produced by the ovaries, and it can also cause increase in the hair growth. And in technical terms, we call it as hirsutism, and we score every person depending on where is the hair growth. Is it on the chin? Is it on the side branch? Is it on chest? On abdomen? On inner thigh? And there is a classification that we follow to understand whether it is mild, moderate, or severe kind of hair growth. But we also see girls and women who have hair loss, that is hair fall, and it can be a male pattern hair fall as well, or male pattern balding that we say. Other than that, as these girls grow up, not only for them it is difficult to lose weight because of PCOS, but they may also face fertility issues if we don't handle these problems at a younger age. And they will also face mood changes or psychological changes, emotional changes. They feel left out when they go out for parties. They have many other problems which are invisible, which we don't know, and this is the biggest struggle that they are not able to lose weight because the hormonal imbalance has reached to that level. But at the same time, genetics is playing one role, but there are factors which are in our control as well. We can change our lifestyle. We can learn how to manage stress. We can learn how to manage our emotions. We can do more of physical activity. We can eat healthy. We can avoid smoking. We can avoid alcohol. So many things are in control of women which need to be taken care of, and that is how they will be able to manage these symptoms well.
Sure. Thank you so much, ma'am, for helping us understand what are the common symptoms which we people take it very casually are actually could be the causes for PCOS and PCOD in the longer term. You talked about the role of diet and the role of lifestyle in managing PCOS and PCOD. Now, my question is to Dr. Shweta. What is the key role that a diet can play, a balanced diet can play in managing PCOS and PCOD?
Good evening, everyone. We were listening to Dr. Nupur, and it's quite clear with her conversation that uh, lifestyle, dietary changes, and modifications, your exercise pattern, that actually cause impact on the overall health of a woman, and in case of PCOS also. As ma'am mentioned, that 75% or 70% cases we can relate it to poor dietary habits or lifestyle changes. So yes, diet has a major role, especially in last 10 to 15 years when we are surrounded by ultra processed food, and food has become glamorized by the food industries. And unfortunately, all this food which we are glamorized with are highly processed, high carb, and high fat kind of food. In case of children, when we talk about children, especially at a young age, as parents, we are so loving, and we want to treat our kids with sugar, candies, and pizza. Party means pizza and ice cream. Party doesn't mean home cooked meal nowadays. So yes, these are the lifestyle, or these are the environmental changes which kids are helpless, because we are introducing all these things to them at a very early stage as a gift, or as we are enjoying. Enjoying means you have to have pizza with you. That's only when you feel like you're enjoying yourself, or Coke. These food industries have glamorized Coke with happiness, friendship, party. They don't talk about the nutritional value of all these substances. Coke is always advertised with happiness, friendship, and party. So yes, food is playing a very important role in overall changing the diet pattern of this generation, and of course ours as well. So in case of PCOS, when we talk about, uh, ma'am has also said that insulin resistance, high sugar levels, insulin spikes, glucose spikes, these hormone spikes or glucose spikes in our blood, these are very much linked to hormonal changes in ovaries and producing of male hormones more when our blood sugar is high, when our insulin is more resistant. So when we talk about these two terms in layman or in general form, how can we identify that uh, we are getting insulin resistant or our blood sugar is high? So the very common thing to understand this is, if you are craving more, you had just your meal, half an hour before, and you had a full meal like two chapati, dal, and everything, or whatever you had, and after 1 or 2 hours you feel like very hungry. So that means that your blood sugar has gone down of a sudden, and now the insulin is coming into action. So this kind of behavior, this kind of pattern is not healthy. If you have your meal, good meal, then you should be able to feel satisfied to at least 3 or 4 hours. So this satisfaction or satiety comes with fiber, with protein. This satiety that doesn't come with high carb और हाई शुगर मील. आप बॉडी को जितना सिंपलर फॉर्म में शुगर देंगे, बॉडी उसको उतना जल्दी डाइजेस्ट करके इट विल वांट मोर, कि अभी जो ग्लूकोज मिला था वो डाइजेस्ट हो गया है, नाउ वी आर हंग्री. अगर आप फाइबर से उसको करते हो मील को, प्रोटीन से कवर करते हो, तो फैट को आप इंट्रोड्यूस करते हो, तो इससे हमारा सटाइटी लेवल अचीव होता है. वी कैन गिव रेस्ट टू आवर डाइजेस्टिव सिस्टम फॉर 3-4 आवर्स, और उसके बाद हमें भूख लगेगी. सो फर्स्ट थिंग इज कि इनकॉर्पोरेट ऑल द फूड सोर्सेज. लाइक ऐसा नहीं कि कार्ब्स बुरे हैं, लेकिन कार्ब्स के साथ में आपको प्रोटीन भी चाहिए ताकि आपका सटाइटी बढ़े, आपको फाइबर भी चाहिए ताकि उसका से हो, और आपको प्रोबायोटिक्स भी चाहिए ताकि आपका गट फ्लोरा जो है, आपका जो गट एंजाइम है, वो गट बैक्टीरिया जो है वो अच्छे से काम करे. सो बैलेंस्ड मील पीसीओएस को ट्रीट करने में या उसको प्रिवेंट करने में डेफिनेटली एक बहुत बड़ा रोल प्ले करता है. सो दैट्स द आंसर टू योर क्वेश्चन.
Thank you so much, Dr. Shweta. Now my question is again getting back to Dr. Nupur. Dr. Nupur is highly health conscious, and she herself been into such intense working hours. She manages time to take out for health and fitness, and thus she exercises. So from your experience, Dr. Nupur, I want to understand what is the role of exercise which plays in management of PCOS and PCOD.
For PCOS women, insulin resistance we just talked about is very commonly seen in most of them, whether they are lean, whether they are obese. So with exercise, we can break this insulin resistance. We can prevent them developing diabetes, impaired glucose tolerance, hypertension, heart disease, high cholesterol, uh, means high lipids, deranged lipids. So many things can be prevented. And exercise uh, are two forms. One is cardio, that will also help, and another is strength training. So for any woman who has PCOS, must work on both the aspects, not only one. And with strength training, they will be able to lose more weight, their protein intake will be higher, and the muscle toning, and the muscle will gain more strength, and naturally it will be easier for them to lose weight. And if your body is used to one form of exercise, after some time it is not going to help you. You need to keep changing whatever you are doing. For cardio, either you are running, you are jogging, maybe you are running on the treadmill, or you are dancing, you are doing aerobics. There are so many forms of exercise that can help you, maybe swimming. But yes, strength training will curb your insulin resistance. And not only in terms of physical health or your muscle tone or muscle health, but it will also help your boost your mental health. So once once your emotional health is at another level, you will be able to manage your course in your daily life. You will find time for exercise, which most of them have an excuse that I am very busy in my work, so I cannot. So I don't have time for myself. So so this is what is Shikha is emphasizing, that you need that 1 hour for yourself, whatever it may be. But this is very important for your long-term health. In your routine life, it doesn't matter, but in the long run, it matters a lot. And in your daily life also, it brings you another kind of energy, another boost. Your stamina will be higher, your work efficiency will be better. You are more positive because good positive hormones like endorphins are released at that time. For any person who has diabetes, also for that matter, whether it is gestational during pregnancy diabetes or maybe insulin dependent diabetes, non insulin, for anyone, if they are exercising, it is very easy to control the blood sugar level, the blood sugar spikes, and also the dose of the hypoglycemic agent that you are taking, the dose of insulin that you need will be lowered. And so many people have been able to control their blood sugar, to control their hypertension only with your diet and your exercise. It does not mean that you will stop medication, whatever it is, but the dose of your medication will be lower and the disease progression will also be slow. It does not mean that you are hypertensive or you are diabetic. We don't say that you stop your medication. It is not a big deal. You can continue whatever it is, but your dosage will reduce, and the effect that the illness causes you in the long run due to diabetes, so many complications we see in our daily life. We see so many family members, friends, colleagues who have diabetes, and we see what is the end of this diabetes. And these are all predisposing factors for chronic illnesses. So if we are able to control at a younger age, in the reproductive age, it will change the life of so many women in India.
Sure. Thank you so much, ma'am. And as you again emphasized on the diet part, I just wanted to check with Dr. Shweta, how can meal planning and portion control can help in managing or reducing the symptoms for PCOS and PCOD?
Okay, so key to a balanced meal is, as we all know, that what the nature is giving us in the form of whole foods, in the form of fruits, vegetables, lentils, eggs, poultry, and meat, etc. So we should. There is a when I used to say this thing to understand कि अगर नेचर ने हमें जैसा फूड दिया है वो जितना कम प्रोसेस होगा, जितने कम बार मैनिपुलेट होगा और आपकी प्लेट में आएगा, वो उतना ही हेल्दी है। अगर वीट को हम मैदा तक लेके आके और उसको स्टोर करके फिर खा रहे हैं तो उसका सारा फाइबर डिलीट कर रहे हैं। सो व्हेन यू प्लेट योर मील, always incorporate all the food sources. आप कार्ब्स भी लें, आप प्रोटीन्स भी लें, आप एक वेल कुक्ड वेजिटेबल भी लें, आप थोड़ा सा सैलेड भी रखें, आप प्रोबायोटिक इन द फॉर्म ऑफ कर्ड और छाछ भी रखें। सो अगर सारे सोर्सेज आपकी प्लेट में होंगे, एक एक कटोरी हर चीज की होगी, तो डेफिनेटली आपका जो कार्ब पोर्शन है, आपका राइस और चपाती पोर्शन है, वो कम हो जाता है। अगर हम सिर्फ राजमा चावल खाएंगे तो सिर्फ दो ही चीज से हम अपना पेट भरेंगे और ऑब्वियसली दोनों का जो पोर्शन है वो ज्यादा होगा। अगर हम तीन चीजें रखते हैं तो ऑब्वियसली इट विल डिवाइड इनटू थ्री पार्ट्स। अगर हम पांच चीजें रखते हैं तो इट विल डिवाइड इनटू फाइव पार्ट्स। सो आप अपने प्लेट में कलर्स ऐड करें। जितने ज्यादा आपका प्लेट कलरफुल होगा, इट मीन्स यू आर एडिंग डाइवर्सिटी एंड ऑल काइंड्स ऑफ फूड सोर्सेज। किसी भी एक सोर्स को डिलीट करना लॉन्ग टर्म कंसिस्टेंटली फॉलो नहीं हो पाता है, बिकॉज वी एंड प्लस उससे रिलेटेड जो डेफिशिएंसीज हैं वो भी बॉडी में आती हैं। कार्ब्स टोटली डिलीट कर देना ओवरऑल फंक्शनिंग ऑफ मेंटल हेल्थ और सस्टेनेबल भी नहीं है। आप बहुत दिन तक बिना राइस और चपाती के नहीं रह सकते और आपको रहना भी नहीं चाहिए। द की इज टू ईट माइंडफुली। आप एक always plan your meal around a protein source. When you are planning about your lunch, think about what will be my protein source, like chana, rajma, paneer, chicken, egg, tofu, beans. उसके आसपास आप प्रिपेयर करिए मील। उसके साथ आप सैलेड कौन सा खाना पसंद करेंगे, घर में आज वेजिटेबल कौन सा अवेलेबल है, आज छाछ पी सकते हैं, सैलेड कौन सा बना सकते हैं। So plan your meal around your protein. Try to add 1 cup of each and every source. छाछ जरूर ऐड करें, फाइबर जरूर ऐड करें, क्योंकि उससे खाने में वॉल्यूम आता है। जितना खाने में वॉल्यूम आएगा, स्टमक में वॉल्यूम आएगा, सैटिस्फैक्शन लेवल उतना अच्छा रहेगा। उतनी ही देर आपकी क्रेविंग्स नहीं होंगी, आप बार बार फ्रीक्वेंट स्नैकिंग नहीं करेंगे, आपका बार बार ग्लूकोज स्पाइक नहीं होगा, बार बार इंसुलिन स्पाइक नहीं होगा। जितनी बार आप पेनक्रियाज को ट्रिगर करेंगे, जितनी बार आप इंसुलिन सिक्रीट करेंगे, उतना ही लॉन्ग टर्म में इंसुलिन रेजिस्टेंस होगा बार बार स्टिमुलस से। So try to maintain a 3 or 4 hour gap between your 2 heavy meals. अगर आप स्नैक लेना चाहते हैं, try to take your snack less than 100 calories. Means आप एक मसाला चाय ले सकते हैं with less sugar and low fat milk. आप कुछ handful of nuts ले सकते हैं, good source of fat and fiber and minerals as well, vitamins as well. आप साथ में चना ले सकते हैं, आप छाछ ले सकते हैं, कोकोनट वाटर ले सकते हैं। लेस देन 100 कैलोरी इज द की। इट विल नॉट स्पाइक योर ब्लड शुगर की बॉडी को उससे दिक्कत हो। सो प्लान योर मील अराउंड द प्रोटीन, इंक्लूड एवरीथिंग विच यू नो अबाउट। प्लेट कलरफुल होना चाहिए, उसमें जितना कलर्स ऐड होंगे उतनी एंटीऑक्सीडेंट्स आपके बॉडी में जाएंगे, विच विल बी हेल्पफुल फॉर योर गट एज वेल। एंड डोंट feed yourself only with highly ultra processed food. एक और मेन बात जो आजकल बहुत चैलेंजिंग हो गया टू कीप इट ट्रैक ऑन इज टू जज द न्यूट्रिशनल वैल्यू ऑफ एवरी पैक्ड फूड। जब भी हम किसी पैकेट को खोल के डायरेक्ट उसको कंज्यूम कर रहे हैं, ट्राई टू रीड द लेबल्स बिहाइंड दैट पैक। एक छोटी सी 100 ग्राम नमकीन में कितना कैलोरीज है ये हमें पता होना चाहिए। उसी से हमारा ओवरऑल कैलोरी एक चाय के साथ में डिसाइड होता है। आप फाइबर के नाम पे डाइजेस्टिव बिस्किट्स, वेरी गुड इन फाइबर, yes they are good in fiber, but with refined flour, with preservatives, with additives and with sugar as well, and palm oil, not good fat. So digestive biscuit या फाइबर के नाम पे जो भी मार्केट में है, सिर्फ फाइबर को, yes fiber is there, but try to read all other nutrients as well. So read the labels, try to build a habit to read the labels behind every pack. इससे बहुत इंसाइट आता है what you are consuming in, क्योंकि सबको लगता है थोड़ा सा ही खाया, 2 चम्मच ही खाया, ये तो कभी कभी खाया, but it affects your health. So balanced meal is incorporate all the nature has given you, not the food industry, and eat mindfully. Plan your meal around the protein, and don't snack too often. 2 good meals, 1 light meal, snack 2 light snacks less than 100 calorie. अगर आप इसको मेंटेन करते हैं लॉन्ग रन में, सो दिस इज अ गुड थिंग, दिस इज अ गुड मील। आपको ज्यादा स्ट्रगल करने की जरूरत नहीं आती है फिर उसमें।
Thank you so much. And for everybody who joined, please feel free to ask any question related to PCOS and PCOD with our experts by typing it on the comment box. Before we close, any last minute advice, Dr. Nupur, Dr. Shweta?
From gynecology point of view, we need to see the adolescent girls at the right time, because from here everything changes. From here the periods start, the menarche starts, and they have a long journey to go till menopause. So for girls and for women who are gaining weight, not able to identify what is the reason, have irregular periods, should not be ignored. And if you have hair growth, do not ignore. Don't just go for laser. Try to identify what is the reason and last but not the least, no need to panic. The thing that comes to mind of mothers when they come with their daughters having PCOS is that will they have fertility issues? But fertility issue is not going to happen if we are able to manage at the right time and with the right mindset and having a healthy lifestyle. So in adolescence, it is the mothers who can change the life of their daughters by bringing them, giving them the right kind of guidance, taking them to a gynecologist to be able to identify as early as possible, because we want that the long term side effects, the long term risk of hypertension, heart disease, diabetes, insulin resistance, and even the risk of endometrial cancer, we can change that history for these girls. So, thank you so much.
Dr. Shweta, any last minute advice from you?
Yes. डाइटरी पॉइंट ऑफ व्यू से जब एक डाइटिशियन की बात हम लोग करते हैं तो पीपल टेक अ स्टेप बैक कि अब रूखा सूखा खाना पड़ेगा, डाइटिशियन के डाइट प्लान को फॉलो करना बहुत मुश्किल होता है, हमेशा नहीं कर सकते हैं. यस, दीज आर द चैलेंजेस. अगर हम इन हेल्दी हैबिट्स के बारे में बहुत लेट अपनी लाइफ में सोचना शुरू करते हैं, एक मॉडिफिकेशन, लाइफस्टाइल मॉडिफिकेशन इज अ चैलेंज. But yes, agar if you want to get a healthy body and healthy mind, you have to take up a challenge. In case of a younger girls, just like the ma'am said, it's yes, it's the responsibility of the parents to to mindfully plate your children's plate, not just with processed food or chocos or milk, और बच्चों को जो पसंद है, अभी छोटे बच्चे हैं कुछ भी खा सकते हैं, शुगर डाइजेस्ट हो जाता है. ये प्यार का फॉर्म नहीं है. प्यार, एक्चुअल लव ऑफ पेरेंटिंग इज कि आप एक हेल्दी बॉडी, एक हेल्दी लाइफस्टाइल अपने बच्चों को इंट्रोड्यूस करें, एंड दैट कम्स विद द किचन. Do spend time in the kitchen, prepare healthy meals for yourself and your family. And अगर आप इनिशियल स्टेजेस में ही, इनिशियल ईयर्स में ही बच्चे का पैलेट इज मोर टुवर्ड्स होम कुक्ड फूड एंड द ट्रेडिशनल डेलिकेसीज, आप पार्टी में भी उन्हीं डेलिकेसीज को वो प्राउडली इंजॉय करते हैं, तो डेफिनेटली लॉन्ग टर्म में ईटिंग हैबिट्स अच्छा रहते हैं बच्चों के. माँ का खाना सबको हमेशा याद रहता है, कॉलेज में जाने के बाद भी और बाद में भी. So yes, let's put a little bit more effort in that माँ का खाना, and of course father का खाना भी कह सकते हैं. आजकल we cannot put too much stress on the female alone. Fathers की भी responsibility है. So home cooked meal is the best meal. Ultra processed foods, cokes, sugars, sugar candies. फॉर एग्जाम्पल एक स्टारबक्स का कोल्ड कॉफी का जो ग्लास है रेगुलर, इट कंटेन्स एटलीस्ट 600 to 700 कैलोरीज. सो नेक्स्ट टाइम जब हम बच्चे को कहें कि आप ये कोल्ड ड्रिंक पी सकते हैं और उसके बाद एक डोनट भी खा सकते हैं, देन वी शुड रिमाइंड आवरसेल्फ कि ये उसका हाफ डे से भी ज्यादा बजट हो गया है. सो वी आर ओवर फीडिंग आवर चिल्ड्रन with too much sugar and too much carb. It's not necessary. This is not love. So try to, change our focus on the natural diet and the traditional diets. Overall, long term, it will be helpful for our kids. And of course, in PCOS cases also.
Sure. Thank you so much, Dr. Nupur, Dr. Shweta, for being present and helping us with such great wisdom and advice for everybody who is either suffering from PCOS and PCOD or know somebody who is suffering from PCOS and PCOD. Feel free to connect with us, follow my 1 hour channel, and we will be coming up with more such great advices and a series of events that will help enlighten your knowledge, and not just that, clear the myths which you have been having from a very long time. Thank you so much for joining. Look forward for the second session. Bye.
Thank you, Shikha.
Thank you so much, Shikha.
Thank you, Shweta.
Thank you.
Bye.
Thank you so much, ma'am.
Thank you.
Insight you have given us is really helpful. Really, really helpful.
Thank you so much.